Hi, I'm Randy Neiswonger, CEO of Community Hospital. Welcome to this edition of Community Beat. Today I have three nurse leaders within our organization. I'll let them introduce themselves.
Hi, I'm Rhonda McKay, the Chief Nursing Officer at Community.
Hi, I'm Carla Meyer. I'm one of the Administrative Directors of Nursing at Community.
And hi, I'm Amber Drinsky. I'm the Manager of Nursing Quality and the DAISY Coordinator.
Welcome, ladies. Rhonda, we've had, obviously there's a lot of headwinds in recruitment and retention in healthcare ubiquitously across the board. One of the areas that we focus on regularly is nursing engagement. Can you talk a little bit about nursing engagement and the importance of that?
One thing that we did as a system is all the hospitals came together and working on nursing engagement. And so we did add it as one of our strategic initiatives for our annual report. One of the things that we are working on is making sure that the life of a nurse is as positive as we can make it. And so we've put some programs in place to assure that we are recognizing the nurses, not only on a daily basis, but on a monthly basis and a yearly basis. So we have different programs like the WOW program that's hospital-wide. We have the Nurses Week that we celebrate all week for the nurses. And we also just put in the DAISY Award.
Amber, I know that you have a significant role in our DAISY engagement. Can you tell us about DAISY Award?
Yeah, absolutely. So we've been doing the DAISY Award, giving the DAISY Award for a year now. We gave our very first DAISY Award last year during Nurses Week. We have had a total of 459 nominations for the DAISY. So that is really a huge accomplishment. That's a testament to how wonderful our nurses are here. The DAISY is an international globally recognized award that's given for nursing excellence. We have had 308 total nurses nominated, and 103 of those were repeat nominees. So it's been really well recognized. We get nominations from anywhere from patients, co-workers, family members. So it's been really wonderful for nurses.
It was very nice this year to see that we have had several nominations for the DAISY Award from our own physicians.
Yeah, incredible. Yeah, so it really falls in line with engagement as well as quality, because what you see is people taking pride in their work, and as
Absolutely.
a result, the quality follows closely thereafter. We have a very important week coming up. Next week, Nurses Week. Carla, can you give us a little insight into what we can expect from Nurses Week next week?
Yes, I am so excited to talk about Nurses
I know you
Week.
are.
Yes, I've been waiting to talk about it. So, first of all, I want to say thank you to the committee. We started in January of this year. It's a heavy lift for everybody. Our kickoff is on Monday the 5th, and we'll start with recognizing our nominees. So we have nominees for both nurse and caregiver of the year. Each unit or area has nominated someone that they feel like is very deserving, and so that's a great way to start off Nurses Week by recognizing those in their area that have gone over and above and beyond that represent the spirit of nursing, and so we're excited. So as Rhonda and Amber talked about, the engagement was really important to us this year, and so we wanted to look at ways that we could really the night shift and all the shifts, and so we really thought about that. So we've got a lot of new things planned, and still those fan favorites. And for the first time ever, I hope everybody's watching this, we are going to be opening up the basket raffles on the night shift. So the night shift, that instead of just seeing the pictures, we're actually going to be opened up from 10 p.m. to 12 midnight on Tuesday, Wednesday, and Thursday. And then we're going to be we have our grab and go meal on the night shift as well. And for the first time ever, we worked really hard because this was a request too. So for anybody that can join in us for the recognition ceremony that we do on Friday when we announce the winners, directly after the ceremony, we're going to have a live feed of the basket drawing for the winners. So if you can come to the auditorium right after the ceremony, we will have the basket raffle drawing.
We've been doing the baskets for around 16 years. And with that, the theme of Nurses Week this week is the power of a nurse.
Yes.
And we've never seen that stronger than we did through COVID. The nurse came to work every day. And the power that they give to their patients, the empathy that they give to their patients is very well noted in the DAISY Award, and many of those nominations will actually bring tears to your eyes. And with all that, the nurses, with their basket raffles and everything else they do during Nurses Week, have garnered more than $350,000 for the Cancer Resource Center.
Yeah. This basket raffle is not a small
No.
thing. This is pretty large. It's actually one of the things that captivate the attention of so many within this organization, and it really benefits a great cause.
So in addition to the Cancer Resource Fund this year, we're also going to take some of the donations and we're going to give back to our Employee Catastrophic Fund as well.
I know that fund has been used in a variety of different
Absolutely,
ways.
yes.
People's house burns down.
Yes.
You know, they need clothing or support of some
Medical
sort.
issues,
Medical issues.
bills.
We've been able to use that fund and tap into that fund
Yep.
for a variety of different
Right.
reasons. And it is truly another very important mission-driven, fund that you guys are helping
And both
sponsor.
are
Yeah.
important. So we
Both
want
are
to make
very important.
yes, and so we wanted to make sure that we contributed to both of those.
This is awesome.
Yeah.
I, as a nurse, I am so grateful for you guys because I know this is something that you guys have a lot of passion for. I know it starts with Rhonda, it trickles down, and you guys are just infectious with your enthusiasm around nurses. So I really am grateful for that. Again, as a nurse, thank you for doing this. It's our profession. It's our drive and motivation to impact patients' lives, and we do so in such a big way here. I'm grateful for you guys. Thank you for joining us, and we'll see you guys next time on Community Beat.